A very good evening to all of you. Today we are going to do preventive and social medicine. Why this subject is important? About 25 to 30 questions come from preventive and social medicine and biostatistics also. Let us begin with the first question. Savlon contains A. Cetrimide plus chlorhexidine, B. Cetrimide plus chlorhexidine plus butyl alcohol, C. Cetrimide plus butyl alcohol. D. Cetrimide plus cetabulum. See, from the image itself, you can tell it is cetrimide plus chlorhexidine. So, correct answer here is A. Cetrimide plus chlorhexidine. Savlon contains chlorhexidine gluconate, that is hibitane, plus cetrimide in various percentages. Savlon liquid antiseptic contains chlorhexidine gluconate 1.5% and cetrimide 3%. Savlon cream contains chlorhexidine HCl 0.1%, cetrimide 0.5%. Savlon hospital concentrate contains chlorhexidine gluconate 7.5% and cetrimide 15%. So the correct answer here is A. Identify the vector in the given figure. A. Louse. B. A. Louse. B. Soft tick. C. Culex mosquito. D. Sandfly. Well, it is A. Louse. So correct answer here is A. Louse. Which of the following trace element has vitamin E-like action? A. Selenium. B. Geomycin. C. Copper. D. Zinc. Well, it is selenium. Selenium deficiency causes what? Selenium deficiency causes Keshan's disease and Kashin-Beck disease. Keshan's disease is a cardiomyopathy endemic in China, and Kashin-Beck disease is an endemic osteoarthritis. Human milk is rich in copper, selenium, and cobalt, but contains less sodium. So the correct answer here is A. Selenium. The item shown in figure is A. Shakir's tape, B. Triage tape, C. Multi-purpose tape, D. Wrist tape. Well, it is Shakir's tape to measure the mid-upper arm circumference. What is the normal value? It should be more than 13.5 centimeter. If it is 12.5 to 13.5 centimeter, there is moderate malnutrition. And if it is less than 12.5 centimeter, there is severe malnutrition. So the correct answer here is A. Shakir's tape. Cluster testing technique is useful in which of the following conditions? A. Sexually transmitted disease. B. Poliomyelitis. C. Measles. D. Smallpox. Well, it is sexually transmitted disease. A. So, what are the methods used for case detection in STD? Number one is contact tracing. Contact tracing is the term used for the technique by which sexual partners of diagnosed patients are identified, located, investigated, and treated. What is cluster testing? Here, the patient are asked name other persons of either sex who move in the same socio-sexual environment. These persons are then screened. So the correct answer here is sexually transmitted diseases. Please go to the description. There, a link is there. Please click the link in the description and join the 3-day Neet PG Breakthrough Blueprint Masterclass. The first 10 people who click the link in the description will get this masterclass, valuable revision, rapid revision masterclass, absolutely free. It will take your preparation to the next level. Which of the following is false about intrauterine device? A. Multi-load CU375 is a third generation intrauterine device. B. Copper devices are effective as postcoital contraceptives. See, these copper devices are second generation. They are not third generation. This multi-load CU375 is also a second generation. So the correct answer here is A. The number of Anganwadi workers supervised by Mukhya Sevika is A 10, B 15, C 25, D 30. It is 25. Mukhya Sevika is a middle level supervisor. She supervises 20 to 25 Anganwadi workers. She is required to be a graduate in social work or home science or a related field. She is trained for 3 months. So the correct answer here is C 25. Minimata disease is caused by toxicity of A. Arsenic, B. Antimony, C. Lead, D. Mercury. It is mercury. It is a significant example of mercury exposure affecting public health occurred in Minamata, Japan between 1932 and 1968, where a factory producing acetic acid discharged waste liquid into the Minamata Bay. The discharge included high concentration of methyl mercury. The bay was rich in fish and shellfish, providing the main livelihood of local residents and fishermen from other areas. For many years, no one realized that the fish were contaminated with mercury and that it was causing a strange disease in the local community and in other districts. At least 50,000 people were affected to some extent, and more than 2,000 cases of Minimata disease were certified. So, this was mercury. D. International Red Cross was founded by A. Henry Dunant, B. John D. Rockefeller, C. Marie Curie, D. None of the above. It is Henry Dunant. Swajaldhara program is associated with A. Provision of safe drinking water provision, B. Provision of food supplement for destitute women, C. Provision of relief for victim of sexual abuse, D. Provision of healthcare for sick tribals. It is provision of safe drinking water. Which of the following screening method is used under RNTCP? A. Active, B. Passive, C. Mass, D. All the above. So the correct answer here is B. Passive. Under RNTCP, what happens? Active case finding is not pursued. Case finding here is passive. Patient presenting themselves with symptoms suggesting tuberculosis are screened with two smutums via examinations. So correct answer here is B. Passive. Dose of oseltamivir in a child aged 9 months is A 2 mg per kg twice daily for 5 days, B 2.5 mg per kg twice daily for 5 days, 3 mg per kg twice daily for 5 days, 3.5. So the correct answer here is C 3 mg per kg twice daily for 5 days. What is oseltamivir? It is Tamiflu. It is neuraminidase inhibitor taken orally activated by hepatic stress. The dose is 75 mg twice daily for 5 days as the treatment. 75 milligram once daily as prevention. Rotavirus does not should not dose should not be initiated beyond which age to prevent complications? Beyond 12 weeks. Dukoral is A. Oral cholera vaccine, B. Oral rotavirus vaccine, C. Oral typhoid vaccine. Ready to use. It is oral cholera vaccine. Being's model of disease causation include A. Spiritual factor, B. Social factor, C. Religious factor, D. Nutritional factor. It does not include religious factors. Being's model, B for biological factor and behavioral factor, E for environmental factor, I for immunological factor, N for nutritional factor, G for genetic factor, S for services, social, spiritual factors, not religious factors. Iodide salt in iodine deficiency program is A. Primary prevention, B. Secondary prevention, C. Tertiary prevention, D. None. It is primary prevention. A person has lost his leg in an accident because of which he is not able to. This is A. Disease, B. Disability, C. Impairment, D. Handicap. It is disability. International disease surveillance is used for A. Hepatitis, B. Polio, C. TB, D. Leprosy. It is polio. Most important component of level of living is A. Health, B. Education, C. Occupation, D. Housing. Attributable risk means risk difference between exposed and non-exposed. Correct answer is C. Parkinsonian bias is a type of A. Selection bias, B. Interviewer bias, C. Information bias, D. Recall bias. This selection bias. Problem of bias is maximum with A. Cohort study, B. Case study, C. Case control study, D. Experimental study. It's case control study. Randomization is done to reduce A. Recall bias, B. Selection bias, C. Parkinsonian bias, D. Recall. D is for selection bias. Secondary attack rate is measure of communicability, lethality, strength of association, D. None. It's communicability. Transovariant transmission is seen in A. Rickettsial disease, B. Malaria, C. Filaria, D. None. It is rickettsial disease. Post-exposure prophylaxis is indicated in HBV, rabies, diphtheria. In fact, it is all. The amount of bleaching powder necessary to disinfect choleric stool is 50 gram per liter, 75 gram, 90 gram per liter, 100 gram. It is 50 gram per liter. Please share this video with your near and dear ones. Thanks a lot. Wishing you all the best for the NEET PG. NEET PG will be held in a single shift.